Hello, and welcome. Today we're diving into the complex world of multiple sclerosis, or MS. This is a disease that affects the central nervous system, disrupting the flow of information between the brain and the body. We'll explore what it is, what causes it, how it's diagnosed, and what options are available for managing this condition. Unfortunately, the exact cause of MS remains a mystery. Scientists believe it's a complex interplay of genetic predisposition and environmental factors. It's not directly inherited, but having a family member with MS does slightly increase your risk. Research points to potential triggers like viral infections, low vitamin D levels, and even smoking as possible contributors to the development of MS in susceptible individuals. MS is primarily an autoimmune disease. In MS, the immune system mistakenly attacks myelin, the protective sheath that surrounds nerve fibers in the brain and spinal cord. This attack causes inflammation and damage to the myelin, leading to demyelination. Over time, this demyelination can result in the formation of lesions, or scars, in the central nervous system. These lesions disrupt nerve signals, leading to a wide range of neurological symptoms. The location and severity of these lesions determine the specific symptoms a person with MS experiences. MS affects millions of people worldwide, with a higher prevalence in regions further away from the equator. It's more common in women than in men, and typically diagnosed between the ages of 20 and 50, although it can occur at any age. The prevalence varies across different populations, highlighting the role of both genetic and environmental factors in the disease's development. The signs and symptoms of MS are incredibly diverse and vary greatly from person to person, depending on which areas of the central nervous system are affected. Common symptoms include fatigue, numbness or tingling, muscle weakness, vision problems like blurred vision or double vision, balance and coordination difficulties, speech problems, and cognitive dysfunctions such as memory problems or difficulty concentrating. Some individuals may experience pain, tremors, or bowel and bladder issues. The unpredictable nature of symptoms is a hallmark of MS. Diagnosing MS can be challenging, as there is no single definitive test. The diagnostic process typically involves a neurological examination, a detailed medical history, and various tests to rule out other conditions. Magnetic resonance imaging, or MRI, is often used to visualize lesions in the brain and spinal cord. Evoke potential studies, which measure the electrical activity of the brain in response to stimuli, can help identify demyelination. A spinal tap, or lumbar puncture, may be performed to analyze cerebrospinal fluid for specific markers of inflammation. MS is often classified into different forms, the most common being relapsing remitting MS, or RMs. In RMs, individuals experience clearly defined relapses, or attacks, followed by periods of remission, during which symptoms improve or disappear. Other forms include secondary progressive MS, which often develops after RMS, primary progressive MS, which is characterized by a gradual worsening of symptoms from the onset, and progressive relapsing MS, which is rare and involves a steady progression of the disease with acute relapses. While there is currently no cure for MS, there are various treatments available to manage symptoms, slow disease progression, and improve quality of life. Disease-modifying therapies, or DMTs, are medications that aim to reduce the frequency and severity of relapses and slow the accumulation of disability. Other treatments focus on managing specific symptoms, such as fatigue, pain, and muscle spasticity. Physical therapy, occupational therapy, and speech therapy can also play a crucial role in helping individuals maintain function and independence. Lifestyle modifications, such as regular exercise, a healthy diet, and stress management, are also important components of MS management. Because the precise cause of MS is unknown, there's no guaranteed way to prevent it. However, maintaining a healthy lifestyle, including getting enough vitamin D, avoiding smoking, and managing stress, may help reduce your risk. Further research is needed to identify specific preventative measures. The prognosis of MS varies widely from person to person. Some individuals experience mild symptoms and minimal disability, while others may face more significant challenges. Factors that can influence the prognosis include the type of MS, the age of onset, and the effectiveness of treatment. Research is ongoing to develop new and more effective treatments for MS, including stem cell therapies and targeted immunotherapies. These advancements offer hope for improving the long-term outcomes for people living with this complex disease.